Welcome to the Safe Feeding Training segment. Our focus is on preventing aspiration and choking, critical aspects of resident safety and care. Safe feeding is critical to prevent choking and aspiration, which is a leading cause of preventable death. Always follow physician and speech therapy orders meticulously. Key feeding precautions include ensuring the correct diet consistency, maintaining an upright 90-degree position, offering slow pace with small bites, and minimizing distractions during meals. Recognizing signs of choking or aspiration is vital. Watch for coughing, gagging, a wet or gurgly voice, difficulty breathing, turning blue or pale or watery eyes. After meals, keep the resident upright for 30 to 60 minutes. Monitor for coughing or breathing changes and report any concerns to the nurse immediately. If applicable, be aware of PEG tube safety. Never feed orally if a resident is NPO. Report any leakage, redness, or dislodgement, and remember that only trained staff may assist with PEG tubes. A PEG tube is a feeding tube placed into the stomach to provide nutrition, fluids, or medications when oral feeding is unsafe. It helps prevent choking, aspiration, and weight loss. Liquid nutrition, water, and medications are administered through the PEG tube. Feeding schedules, whether bolus or continuous, must strictly follow the doctor's orders. Staff must follow doctor's orders exactly, keep the site clean and dry, and watch for signs of infection. If the tube is dislodged or damaged, report it immediately and never use it. Report immediately if the tube comes out or looks loose, or if the resident experiences vomiting, coughing, difficulty breathing, redness, pus, odor, fever, or pain during feeding. This section covers safe feeding assistance for clients at risk of choking. Our objectives include understanding risks, applying safety procedures, and knowing how to intervene safely. Common choking risk factors include dysphagia, neurological disorders, poor oral motor control, fatigue, positioning issues, and inappropriate food textures. First, prepare a quiet environment. Ensure the resident is seated upright at 90 degrees, remove distractions, and verify that the food texture matches the care plan. For proper positioning, the client must be upright at 90 degrees with the head slightly forward. Feet should be flat on the floor, and the caregiver should be seated at eye level. Use small spoonfuls, placing food in the middle of the tongue. Encourage slow chewing and swallowing. Never force feed or tilt the head back, and monitor for fatigue. If choking occurs, stop feeding immediately and encourage coughing. If the client cannot speak or breathe, call for help and begin abdominal thrusts if you are trained. In this scenario, Maria, who has a history of choking, is on a mechanical soft diet with nectar-thick liquids. She is taking large bites and drinking thin liquids, then begins coughing and is distracted.
Correct response. Immediately stop the meal. Remove unapproved foods, ensure she is upright, and redirect her attention. Provide small, slow bites according to her plan, and if choking occurs, follow emergency procedures.
This next section focuses on medication safety, which is vital for the health and well-being of our residents. The Medication Safety Overview emphasizes following the 7 rights of administration. Never share medications, observe for side effects, and report any refusals or adverse reactions promptly. The 7 rights of medication administration are right resident, right medication, right dose, right route, right time, right documentation, and right reason or refusal. Medication safety do's include verifying the 7 rights, washing hands, following the R and ISP, assisting residents, documenting immediately after giving, and reporting errors promptly. Medication safety don'ts include never sharing medications, never leaving them unattended, not rushing or multitasking, not altering medications unless prescribed, and not ignoring side effects or refusals. Early recognition of medication side effects is critical, especially since residents may not always report how they feel. Side effects can indicate the medication is too strong or interacting with other drugs. Watch for physical signs like dizziness, rash, or vomiting, and behavioral changes such as agitation or confusion. Serious signs include difficulty breathing, chest pain, or severe allergic reactions. If a resident refuses medication, calmly ask why, offer encouragement, and never force the medication unless specified in the ISP. Record the refusal and notify the nurse or prescriber immediately. For adverse reactions, observe the resident, stop administration if safe, notify the nurse immediately, follow emergency protocols for severe reactions, and document the incident thoroughly. Staff must never ignore refusals or reactions, assume minor symptoms are unimportant, or delay reporting. Timely reporting ensures effective and safe care. In this scenario, a new staff member mistakenly gives Tom double his prescribed blood pressure medication dose. Shortly after, Tom appears unusually drowsy and dizzy. Question: what should you do immediately to ensure Tom's safety and handle the medication error? Here's the correct staff response. Immediately ensure Tom is safe, assess his symptoms, and notify the nurse or prescriber. Follow emergency protocols if needed, document the error accurately, and review procedures to prevent recurrence. This section covers the importance of recognizing and reporting a change of condition in our residents. A change of condition is any significant deviation from a resident's normal physical, mental, or emotional status that suggests a new or worsening health issue. Mental and behavioral changes include confusion, agitation, lethargy, or any sudden shift in their usual behavior. Physical signs of change include fever, shortness of breath, new pain, sudden weakness, falls, swelling, or skin breakdown. Watch for changes in intake and output, such as poor appetite, reduced fluid intake, or alterations in urination or bowel patterns. Monitor vital signs for abnormalities, including blood pressure, heart rate, respiratory rate, and oxygen saturation levels. Other serious changes include new seizures, choking, aspiration, persistent vomiting, diarrhea, or any unexpected bleeding. Staff must stop and assess the resident's condition against their baseline, ensure safety, and report immediately to the nurse or administrator. Document all symptoms and actions taken. Call 911 immediately for severe symptoms such as trouble breathing, choking, unresponsiveness, chest pain, stroke symptoms, severe bleeding, seizures, or rapid decline in condition. Early reporting of a change of condition is crucial. It prevents complications, reduces hospitalizations, protects resident safety, and ensures regulatory compliance. In our scenario, Sarah, a 38-year-old resident, suddenly appears pale, is quiet, rubs her stomach, refuses breakfast, and seems weak. These signs are new and sudden for her. Question: what should the DSP do immediately upon noticing this change of condition? The immediate response is to assess Sarah safely, noting symptoms like pallor, weakness, and refusal to eat. Notify the nurse immediately with specific details, and strictly follow the care plan. Continuously monitor Sarah until the nurse arrives, watching for worsening symptoms. Clearly communicate the change and any new instructions to other staff to ensure continuity of care.